Hello, I'm Paul Nelson, and welcome to Man Academy. Today's class is on intracavernosal injections, also known as penile injections for the treatment of erectile dysfunction. We're going to cover a lot of material. Stick around, there's a lot to learn. The first time a guy hears about injecting something into his penis, he tends to cringe. The fact is, it really doesn't hurt. The thought of it is far worse than the reality. For the right patient, penile injections are a great treatment for erectile dysfunction. The erections start in about 5 to 10 minutes. They're very firm, and they last anywhere from 20 minutes to 3 hours. You get to decide how long based on the dosage. One of the first questions I always get from every guy is this liquid Viagra? And the answer is no. The injections are totally different. With the right blood flow, they'll create an erection no matter what. You can even be unconscious and they'll give you an erection. In fact, that's how one of the drugs was discovered. A doctor in France, during surgery, accidentally injected a guy in his penis. The guy on the operating table got an erection. Let's not even discuss how a doctor accidentally injects in a penis. In this class, you're going to learn all about the various drugs that are used, how they're made, how they work, and even some of the side effects. We're also going to have a chance to see a doctor demonstrate on a live patient exactly how he wants you to inject. We're going to learn how to use an auto-injector as well as a plain syringe. We're going to discuss some common mistakes and problems that men might encounter along the way. We'll offer you some tips and tricks and hints to make things a little bit easier. But most importantly, we're going to teach you how to integrate it into your sexual experience so that things don't come to a screeching halt as you take time to inject. If you'd like to talk to other guys who are using penile injections, go over to FrankTalk.org. There's a discussion forum there with thousands of posts on penile injections. You can read everything you want to know there. You can even join and ask your own questions and get lots of answers and support from other men. And most importantly, you absolutely must be under a doctor's care when using penile injections. These are drugs, and like any other drugs, they have side effects. The most common side effects are pain at the injection site, a priapism, the 4-hour erection, and penile pain in general. Be sure to be talking to your doctor while you're going through this process. There are 3 different drugs used to create an erection: phentolamine, papaverine, and prostaglandin E1. There's a drug called alprostadil, which is the synthetic version of prostaglandin E1. You may have read about that online. Now, prostaglandins exist in virtually every tissue of your body. They're a molecule that turns cells on or off. There's a receptor on the cell wall. The prostaglandin comes along, touches the receptor, and makes the cell do something, sort of like a light switch. In penile injections, prostaglandin relaxes the smooth muscle tissue in the penis. Now we have to back up. In the penis, the corpus cavernosa is the long, spongy tissue that gets erect. That spongy tissue has little holes in it lined with muscle cells. These cells are tight all day, keeping the blood out. The prostaglandin comes along, hits these muscle cells, they relax, that little hole balloons up, and we get an erection. Because prostaglandin is a naturally occurring chemical, it does a great job at creating erections. But it has 2 major drawbacks. The first, in its liquid form, it has to be kept refrigerated. Otherwise, it begins to break down fairly quickly. The other is, for about 1/3 of all men, it can create some pain in the penis while it's being administered. Now, for some guys, it's a mild ache. To others, it's pretty substantial. Too bad, huh? Phentolamine and papaverine are vasodilators. That means they just force the smooth muscle in the tissue of the penis to relax, and it causes an erection. They're very safe. They don't need to be refrigerated, and they do not cause any pain. The downside is they have a higher risk of causing a priapism. That's the dreaded 4-hour erection. All of these drugs require a prescription, but you can't get them at your local drugstore. It needs a special pharmacy called a compounding pharmacy, which is licensed to make drugs, and it needs to be made especially for you. Now, chances are you don't live near a compounding pharmacy. Your doctor probably has a pharmacy he trusts. You'll get it in the mail, usually wrapped in an ice pack. It's up to your doctor to prescribe exactly the right combination of these drugs for you. Many doctors start with just prostaglandin. However, I think it's safe to say that most doctors eventually move on to trimix. That's all 3 drugs mixed together. Trimix, get it? Now, if guys can't tolerate the prostaglandin, we just use the other two drugs, and that's called Bimix. Pretty original, huh? As we said, your doctor prescribes the right dosage for you. Now, some men need really strong versions of these drugs. Guess what they're called? Super Bimix or Super Trimix? Aren't these names amazing? And yes, in case you're wondering, some pharmacies do offer a quad mix. They add some other vasodilator, they experiment with a whole bunch of different drugs. So far, none of them have come up with anything that really makes much of a difference. As we mentioned earlier, prostaglandin in its liquid form must be kept refrigerated. What happens if it isn't kept cool? It breaks down and it simply stops working. Now, it doesn't go rancid or turn into anything that will hurt you, but don't waste your money. Keep it in the refrigerator. Now, Bimix does not need to be refrigerated. It can hang out in your bedside table, but like any drug, extremely hot is never good for it. Frankly, many pharmacies recommend you keep all of these drugs in the refrigerator just to be safe. I often recommend that men make up several syringes and keep them in the refrigerator ready to go at all times. Keep the vial in the freezer. Take it out only when you need to make up more syringes. Like any prescription, these drugs come with an expiration date. Once the drug expires, it just doesn't work as well. It won't hurt you, it's just weaker. So, do your best, have a lot of sex, and use up the drugs. There are two brand name versions of prostaglandin on the market. They're called Caverject and Edex. They were approved by the FDA in the mid-1990s for penile injection. The benefit of these systems is it does not need to be kept refrigerated, and it's pre-measured. Now, some insurance companies will cover Caverject and Edex. However, the other two drugs, phentolamine and papaverine, have not been FDA approved for penile injections. This is called off-label use. I often hear men say, because these drugs do not have FDA approval, they're dangerous and they shouldn't be used. The fact is, we have many drugs in our system that are off-label use. Doctors have prescribed these drugs for years to millions of men safely. It's really important to understand the FDA process and what's involved in getting approval. A drug gets FDA approval after a drug manufacturer invents a drug. It goes through years and years of clinical trials where they determine the dosage, the risks, the side effects, and the benefits. It takes millions and millions of dollars to make this happen, and it requires a committed team of doctors, businessmen, and attorneys. Once the FDA approves a drug, it is licensed for a specific dose, in a specific occasion, in a specific delivery system, for a specific illness. In addition, these drug companies get a specific length of time for their patent on this drug. No one else can make this drug while it's under the company's patent. However, once that patent expires, anyone can make this drug, and it's called a generic. And that's what we have with these injection drugs. They've been on the market for years, and they are all generics. So no company is going to spend millions and millions of dollars and decades of time to get FDA approval for drugs that they will never be able to hold a patent on. It would be a total waste of money, and no one is ever going to do it. Okay, let's review real briefly exactly how and why these drugs work. Remember, in the penis, there are two chambers called the corpus cavernosa, and that's spongy tissue filled with blood. And in the sponge are little tiny holes that are lined with muscle cells. These muscle cells are tight all day long, keeping the blood out. Now, when the drug is injected into the penis, it acts on these muscle cells, causes them to relax. These muscle cells relax, that little space balloons up, you've got billions of those, and now you've got an erection. Make sense? Okay, so now you have a history of the drugs, how they're made, how they're stored, and a few other details. We've just finished our first class. Let's go on to the next class where you're going to be able to listen to a doctor answer a bunch of questions about penile injections.